Have you ever felt like your brain is wired differently? Like you're constantly fighting against yourself? Maybe you visited a doctor's office, hopeful and ready for answers, only to hear you're just stressed. Maybe you're depressed. You did well in school, you can't have ADHD. But here's the uncomfortable truth. Many healthcare providers aren't telling you everything, not necessarily because they don't care, but because the system itself is designed to keep you from easy answers. If you've ever felt invalidated, dismissed, or misunderstood while seeking answers, stay tuned because in the next few minutes, you'll discover hidden reasons why ADHD is hard to diagnose, genetic clues providers often overlook, exactly what providers need to see before diagnosing you, why adults struggle to get diagnosed, and common medical conditions mistaken for ADHD. Your journey to understanding starts now. Number 1. The genetic truths providers rarely discuss. ADHD doesn't just develop randomly. Research shows a 50 to 80% genetic link if one parent has ADHD. But have providers ever asked about your family history? Imagine this scenario. You struggle daily with impulsivity and forgetfulness, symptoms your parent or sibling might also quietly experience. But your family members have masked these symptoms, never diagnosed due to outdated medical practices. Your provider misses these critical signs because they simply don't ask. Ignoring this genetic factor means missing a major diagnostic clue, leaving many people undiagnosed and misunderstood. But genetics aren't the only barrier. Providers also rely on a strict requirement of significant impairment. Here's the hidden truth behind this rule. Providers won't diagnose ADHD based on symptoms alone. They require clear evidence that these symptoms significantly disrupt your life. Let's dive into what that truly means. Social impairment. Ever zoned out mid-conversation or interrupted unintentionally? Friends might label you as unreliable or inattentive, making friendships harder to maintain. Work and school impairment. You might procrastinate until the last minute or hyper-focus on irrelevant tasks, missing critical deadlines. Providers often overlook your struggle if you seem competent externally. Daily life impairment. Everyday tasks like bills or household chores feel impossible. Your living space might be constantly disorganized, leading providers to dismiss you as simply careless. Many providers quietly use these criteria to deny a diagnosis, especially impacting women and minorities who mask their symptoms better. Yet, even if you clearly show impairment, providers still might dismiss your case due to an overlooked childhood rule. Number 3. The childhood rule providers rarely question. Providers insist ADHD symptoms must start before age 12. But what if childhood signs weren't obvious? Maybe you weren't hyperactive, but instead daydreamed or were labeled lazy. Good grades and learned coping mechanisms might have hidden your ADHD for years. Providers often deny diagnosis without clear childhood evidence, unfairly excluding adults from getting the help they desperately need. And if you do meet all these criteria, there's still another hidden obstacles providers rarely address: misdiagnosis. Many conditions mimic ADHD. Thyroid disorders, symptoms like brain fog and fatigue get mistaken for ADHD. Vitamin deficiencies, low B12, vitamin D, or iron can mimic attention issues. Sleep disorders, poor sleep quality produces symptoms similar to ADHD. Providers might incorrectly label your ADHD as anxiety or depression, and even bipolar disorder, delaying accurate diagnosis and proper care. Understanding these hidden obstacles is just the beginning. So, what can you do next? Let's talk about the steps you can take to reclaim your clarity and confidence. ADHD is complex, and the journey to understanding it isn't always straightforward. If you've ever felt dismissed, misunderstood, or unsure about your experiences, know that you are not alone. Your struggles are real. Your experiences matter. And most importantly, there are answers. Whether it's through self-reflection, seeking a second opinion, or connecting with others who understand, clarity and validation are within reach. If this video helped you feel seen, consider sharing your thoughts in the comments below. You never know who else might need to hear what you have to say.